Welcome to the Dual instruction video. Place the mattress at the foot end of the bed and roll it out flat. Connect the straps to the bed frame to secure it in position, taking care not to interfere with any moving parts on the bed. Make sure that CPC connectors are properly connected and that they both click into position. Make sure the plug is properly inserted in the wall and into the pump. Make sure the CPR valve is properly and firmly inserted. To switch on the system, press the rocker switch. The LEDs will flash once. After that, press the power mute button. The system starts with the default mode of 30 kilograms and 10-minute cycle. Please allow 30 seconds for internal testing. When the system is switched using the rocker switch only, the system will start back in the memory mode with the previous settings. To set, for example, 70 kilograms, push repeatedly on the kilogram button. If you go over the desired weight setting, carry on pressing the kilogram button until the correct weight setting comes back round. The default cycle time after the pump has been switched on is 10 minutes. The display shows the cycle length in minutes. 10 minutes means that cells A are inflated for 5 minutes, while cells B are deflated. Then cells B are inflated for 5 minutes, while cells A are deflated. This is the most effective cycle in terms of pressure relief. Longer cycles are advised only when patients are especially sensitive or during the night. Static is shown as 0. For patients that are not suitable for alternating pressure, for example spinal injuries, please select static. Firm or nursing mode. The system can be inflated to firm to mobilize and wash the patient. It is only operative after the system is fully inflated and has started its cycle. The firm mode switches back to the original setting after 25 minutes. This function is for use when the patient is in the upright position in a profiling bed. It reduces the risk of bottoming out by slightly increasing the internal pressure. The cycle timer gives an indication of how much time has passed in the cycle. The LED indicates when the system corrects or changes internal pressure. The LED visually indicates low pressure. There is an audible alarm when the mains power is interrupted. Please use bed linen on the mattress. Make sure you don't tuck it in too tight. Otherwise, the pressure relieving effect will be reduced. Place the patient on the mattress in the same way as on a normal mattress. The inflation tubes are at the foot end of the mattress. Caregivers should always perform a hand check by placing their hands underneath the patient's pelvis area to check if there is sufficient air support to ensure the patient is not bottoming out. When transporting a patient for longer than 20 minutes, please interconnect the CPC connectors on the mattress hose. The system will stay inflated up to 6 hours. To ensure maximum duration, please press the firm mode beforehand and wait 3 minutes. In case of cardiopulmonary resuscitation, please pull the CPR valve tag. Don't wait until the mattress is empty before commencing CPR. The mattress consists of 20 individually replaceable air cells. Pull out the old air cell and replace with a new one. Please check if the plug is correctly inserted. Please verify there is an electricity supply. Please verify the rocker switch is on. Then please press the mute button again. Please check that there is airflow. Please verify that the mattress tubes are not kinked. Please switch off the system. If the alarm keeps sounding, please check the operation manual or contact your local distributor again.